Hello and welcome to our second webinar about the new manual of Practical Veterinary Welfare. Today, Matthew and I have been joined by co-editor Joe Hind. In this webinar, we're going to delve a bit more into the content of the chapters. Joe, you've co-authored the chapter on animal behaviour with Anne McBride. Can you introduce us to the chapter and what main topics are included?
Yeah, definitely. Thank you. It was a real pleasure to work with Anne on the book. She is an absolute wealth of knowledge on animal behaviour and human behaviour as well. And that's something that Matt and I really wanted in the book, was to have that crossover. So not only are we helping with the animal side of things, but with how to do behaviour change and learning change with humans as well. So it's a really in-depth chapter. We're trying to pack as much as possible in, both with the content that we've written, but also extensive references on this chapter as well, so that people can continue to dig through and find out specific bits about specific bits of behaviour. It's a huge subject, so we've tried to kind of dip into everything from socialisation, communication, how behaviour change can work, animal behaviour, human behaviour. One of the bits that I'm really interested in is the language that we use, both to clients and around animals. And so there's a bit in there on that, for example, labelling of an animal as aggressive. Do we truly have an aggressive animal? Is there such a thing? Or is it a combination of behaviours that result in it reacting in something that we perceive as an aggressive manner? So, for example, if you've got a great big red care bites danger label on the front of the cage, we are naturally, as a human, going to want to defend ourselves a bit more, and that's going to change how we react to that patient. Whereas if we have a more helpful label that has doesn't like injections, or is funny about its back feet being touched, something that gives us something to work with, we approach it in a better manner, and therefore we're less stressed and the animal's less stressed. So the chapter also goes through operant conditioning and different types of conditioning, different types of reactions, and all the way back to the very start of behaviour and nature versus nurturing and things like that. So we've really tried to pack as much in as we can.
Excellent. So can you tell us a little bit about how an understanding of animal behaviour can improve their welfare?
Yeah, definitely, very much so. I think we're kind of getting used to, in the veterinary sphere, looking at species-specific care, and we're very good with our cats and dogs, and now our rabbits are kind of coming through that as well. That can kind of tailor off when we get through to different species, and it can be quite difficult to find species-specific information out there. But you can pull that through into commonalities as well. So in the book, we've created these commonality behaviour tables, for example, for fear and anxiety. So even though we want to look at species specific, if you're in clinic and all of a sudden something rocks up that you've never seen before, and there's not a lot of information on, there are some things we can do. For example, if it's an animal that has eyelids, then if it's squinting, then there's a high chance that it's actually in pain at that point, or fearful at that point. The same with ears. If it's got external pinners and they're held flat back to the head, again, we can extrapolate from that there's probably a high chance that it's feeling quite fearful at that stage. So understanding behaviour is really important, so that we can give them the best care that we can, and the most stress-free care that we can as well, because we need to look holistically and beyond the fact of we have a bundle of symptoms. We need to remember it's a patient, and it thinks and it feels, and we have a duty of care to help it live a good life, not just a long and healthy life. We've got to think about all of the behaviour and the welfare that can be affected.
And the last question I had for the chapter is, communication between humans and animals is key to welfare. What are the most important things to recognise?
Yeah, absolutely. I mentioned briefly about our perceptions of a patient, and that can make a difference. But communication again goes down to that species-specific understanding. So broadly speaking, you can channel that down to predator and prey. And I think those are the top levels that are really important. And to understand, even if you don't know that what a particularly a sugar glider does, but if you know where it falls in the predator and prey category, you can kind of then extrapolate what's going to stress it out, and what's going to calm it down, and what sort of things it needs. So, prey species, are going to need to hide away, they're going to need to stay dark and calm and things like that. Whereas predators are probably going to enjoy a little bit more interaction, probably dogs, for example, are going to, in general, get more comfort from a human going in and having a play with them, and grooming them and things. So
I think one thing that we really wanted to cover was to make sure that people are challenging their beliefs on behaviour, and how we all, as veterinary professionals and anybody caring with animals, biologists or whoever has a role in caring for that animal, you develop an unconscious bias towards that animal species and that individual. So I think we need to challenge that, because it does sometimes compromise their welfare. So if you think all Rottweilers are all horrible and going to bite you, then it will change how you approach them. And I think some veterinary professionals could be a bit closed about that. And I think it's really important that we just challenge all of those things. And I think that's what Anna's always done, because she's not a veterinary person. She kind of looks at our kind of systems of work and things from a very different angle. And that's why Joe and I were super keen to have her involved with writing the chapter with Joe, because her depth of knowledge is incredible. And she looks at it as to, and sometimes it's quite unnerving, but she looks at it as how she knows why we feel how we feel about what we're feeling. So, which is quite mind-boggling, really. But a conversation with her makes you really understand why you have those perceptions and how it alters your approach to animals, and ultimately allows you to provide a very welfare positive outcome. Or actually, sometimes we are compromising those animals' welfare without really realising it, which is a huge thing.
Yeah, I think awareness is key, isn't it?
Yeah.
Just sort of recognising and challenging.
Because as vets and nurses, we don't get taught a lot about animal behaviour. It's not really a big part of our curriculum. We learn the mechanics and the nuts and bolts of what we do, but not a lot about we learn a lot about the science, but less about the kind of the art of what we do and how we interact with animals. So I think this chapter really covers that extremely well. So.
Yeah, and it goes through, it links really nicely with the training chapter that we've got, that Jim's written, because obviously training and behaviour are so interlinked, but it gives some depth behind that with regards to how to implement change for both the caregiver's point of view, so from the human's point of view, but also from the animal's point of view, and how to go through those, how to effectively do training and communication with them.
Yeah, I think throughout the whole book we've tried to give really practical tips, things that you can go away and do today. It's not something that you need loads of equipment or loads of huge depth of knowledge and understanding. They're just little bite-sized tips that you can do and actually really improve the welfare of the animals we're caring for.
It just makes you think, isn't it? Just think outside the box, question why are we doing it? And because we always have, isn't a good enough reason. Let's actually think about it. If we want to do a clinical audit on something, then speak to the team and see how much of a change needs to be made. It could be something literally as simple as in rabbits not giving intramuscular injections when they're conscious, because it is painful and it's stressful. So let's give them subcuticular, and that's a really quick and easy change that can be made straight away with minimal things needed. So and we've deliberately written it in very plain English speak as well, all of the chapters, so that it is suitable for non-clinical people. So basically anybody that has hands-on care for animals, whether you are an owner or you work in research or laboratory or zoo collections or colleges, doesn't matter where you are, then this will benefit the human and the animal welfare that is going on. So.
And Matthew, I was going to chat to you a little bit about your chapter. So you've written the chapter on One Health with Becky James. So can you introduce us to the concept of One Health? Sort of, what is it?
Yeah, I think if you've got a couple of hours, we can run through all of the different facets of One Health. She was really interesting for me, and I learned a lot from writing the chapter with Becky, just looking at the different aspects of One Health. And One Health has become a little bit of a buzzword, and sometimes that detracts from what it actually is. And I think the key thing is One Health is about how an action has an influence on everything in that environment. So that can be people, that can be ongoing environmental pressures, but also animals, and how interactions with animals, we need to be mindful that we're gaining all of the information and looking at the long-term impact that it has. We've certainly seen this with COVID. Obviously, we were in the middle of COVID, and we know that has had an impact on how certain species of wildlife are being looked after, because there's this perception that actually they might have been the cause of it, where actually we don't know they are. So it's fascinating. And I think the key thing for me about One Health is making sure that we're using it in a positive and blame-free way, because I think it's a term that we can use to kind of bracket things that we do. So one of the projects I'm working on is primates in Africa, and looking at releasing them, but also looking at how, if we release them, we need to support the villagers that those primates are going to go in and steal all their food and wreck all of their crops. We have to provide that support, and I think that's where One Health is really important. And it does start in practice. It's not it doesn't have to be at a global level. One Health is understanding that you will have owners with mental health issues, that although they will be struggling to look after their animal, their intentions are good, and that animal is a support animal for them. And I think there's a lot of aspects within that as well. And then also flipping that around and looking at the stresses involved that animals that are trained to be support animals, so hearing dogs and guide dogs for the blind. These animals have a stressful job. They have a job to do, and it's an essential job for that human being, but their life is stressful, and that needs to be incorporated in One Health as well. There's always for every action there's a reaction, and I think that's what's important. And I think Becky and I have covered it in a way that is applicable to in practice, but also to biologists and students working all around the world, because I think it's too easy to just kind of bracket it with not actually looking at how much stuff it covers. And I think we are all doing things that are One Health in practice every day. So
yeah. I mean, obviously, you touched on the pandemic there. I was going to ask about other zoonotic diseases in practice. What are the most important ones to sort of remember and sort of recognise?
Yeah, I think it's really interesting. So I don't think their prevalence is as high as we think, but I think we have a funny situation in the UK now where there's quite a lot of people that are anti-vaccinations in dogs. So we are seeing leptospirosis increasing now, which is sad, because that was a disease we really didn't see. And also parvovirus. So again, because of anti-vaccine people, we're just not getting people vaccinating their animals, and those animals are suffering from parvovirus. And again, that's a really good example of unconscious bias, but also looking at One Health from your own perspective without considering the impact it has on the animal. The animal has no choice in exactly what you're going to do with its vaccinations, but you're exposing it to a huge amount of risk. So I think we are more aware in practice now, and obviously we have bird flu in the UK as well, just to add it to the mix at the moment. So we're aware of the impact that has, and I think as nurses working on the ground, we encounter those things all the time, trying to explain to owners that their choice to not vaccinate their animal can actually have a knock-on on the animals that animal meets, and it's a huge responsibility. And I think we're very mindful of biosecurity, but One Health is not just biosecurity; it's a massive, massive area. And I think, like welfare, I think one thing I've started to do over the years is I always look at everything from a welfare point of view. So everything I do, you kind of try and bounce it into your kind of welfare assessment, if you like. So one thing that dawned on me the other day, and actually was talking to Anne McBride about, was about how we're very keen to restrain small dogs. So if you get a small dog like a Chihuahua or something small and it's aggressive, or it's fearful, you will restrain it because you'll be happy to wrap it up in a towel and just pin it down. If you get a 40-kilo Mastiff that comes in, you're not going to pin it down. So without realising it, unconsciously, you've prejudiced against that animal. And that, again, is part of being One Health. It's part of just looking at, actually, if you wouldn't do it to that big dog, why wouldn't you do it? So why do you do it to the little dog? So it's fascinating. And I think when you extrapolate that to other species, so as Joe and Anne have covered in the behaviour, if you meet an animal very infrequently, that one encounter will influence how you approach that animal moving forward. And that's super important. So I think One Health is a kind of emerging area within veterinary professionals, but I think it's an emerging area on every kind of table now. So I think the government are very much more aware of it than they were. So we know from intensive farming and all these things, they all have an impact. So I think that I think writing that chapter was an opportunity to really drill down and kind of document what actually is One Health, which I think it makes it a very interesting and accessible read.
Definitely. And I mean, obviously there's the links between sort of One Health in the veterinary profession and One Health in the medical profession as well. And you can see those sort of crossing boundaries.
Absolutely. I think we sometimes a bit quick to sometimes judge owners, certainly with exotic pets. I think sometimes we judge them a bit quickly. And most people have not gone out to do it badly, they've just taken bad advice. And I think it's really important that we kind of gather those people in, because if as we have a huge responsibility as veterinary professionals within the One Health framework to not push these people away, because ultimately that means they won't get the resources, they won't get the good advice, and that animal's welfare will be compromised more. And that's quite hard for us to take as veterinary professionals, because we think we always do a good job, and we don't, unfortunately. we try and we put all of the effort in we can, but sometimes we need to be mindful of reflecting on the impact we have. So I always talk about the Velvet Mallet. So when you get people in that are not looking after exotic pet properly, they don't mean to, and they probably have got this animal because it's a comfort to them. It's something that they need to improve their mental health. So if you're particularly unpleasant to them, they just won't seek advice. Whereas if you give them that advice, but slightly soften it a little bit, and then they'll understand it and they'll take on board, and you've gathered that person in and improved that animal's welfare. And also probably improve the welfare of that people's family. So if that person is grumpy and miserable because they've had a failure with an animal that they really, really love, and they genuinely do love these animals, it will have an impact on the people around them because they will be miserable and unhappy. So huge responsibility and a massive topic to cover in one chapter, but it's excellent to work with Becky on it. I really enjoyed writing it.
And I think our duty of care to owners, as you've highlighted, is really important, because it's something that often we forget, and we don't think about the circumstances as to why that owner is non-compliant. So why that animal isn't getting its eardrops, or why that animal isn't getting its long-term medication. We don't know, we don't have the time or the training to know whether what's going on in the family life. Is there money problems? Is there all sorts of bits and pieces? And there's been some great work done under the One Health banner, certainly by Liz Ormond and some other people, that looking at that infrastructure and trying to make everybody work together. So you don't have to be a human nurse or a social worker, but you can have links and help signpost through. And I think a lot of the book has a lot of signposting in it as well, of where to get more advice, and just to be aware that actually that client that you have tagged as aggressive or annoying, in the same way we can tag our patients as aggressive or yappy or whatever, there's going to be a reason why. So again, the One Health chapter digs into that to say you don't have to fix it, but just be aware, be on the lookout for it, wonder why we've got this non-compliance, and just dig a bit deeper. So treat it like a symptom, and find out what is the cause of that symptom. We might not be able to fix it, but we can be aware and help show sympathy.
And I think
help the
I think that's why we wanted to include a chapter on the team's well-being as well. Because I think if you're happy at work and you're content in your environment, you will do a much better job. And I think, again, that's hard for veterinary professionals. We tend to be those, we don't take our breaks, we work like crazy, but actually we end up not doing a good job because of it. And again, that's quite a hard thing to face up to. But I think, again, that's been covered by Amy Martin and the gang in that chapter, that really just looks at what makes us happy, what makes us work well, and what makes us content in our environment. And I think being able to look at that in a blame-free way, so I think is also a very enlightening chapter, and really makes a very good read, because again, it's things that are accessible and things you can change straight away. It's not a load of computer programs or investment, or it's just changing your mindset of how you approach welfare of the people and the animals we care for.
Yeah, so I think, a happy veterinary professional makes for a happy owner and a happy patient.
Yeah, absolutely.
And it's difficult times right now. We have got shortages. We have got kind of strange impositions on us that we can't necessarily get hands on as we want to, or the owners can't always be in the same room, and that creates different challenges as to how to communicate and how to support our clients at this time. It's tricky, but it's a really good chapter to help look at that and highlight what can, as Matt says, what can be done, and to change the narrative of what a veterinary profession what the job is. So to stop wearing the wrong badges, as I call it. So, you know, that you always stay late, you always push through, you always, you know, oh yeah, you can count on so-and-so because they'll always stay late if you need to. Well, we can be dependable, we can do our job, but actually being that person is exhausting, and we shouldn't be rewarding or highlighting these people because they're pushing themselves too far and they're trying to do the best they can. So we just need to change that narrative and go, actually, we're highlighting the people that are taking their breaks and that they are finishing kind of on time, and you know, that we just actually, it is unacceptable to have to push on through. So let's look at our work processes, what needs to change to allow us to have our breaks. You know, because lorry drivers aren't allowed to go a certain amount of time because we know their concentration drops. It's the same for us guys, but we've got the emotional fatigue on there as well. So it's really important to try and help the team. And we're not looking for an all-hugging, kumbaya singing team every day, you know, team warm-ups. But just to, again, have that appreciation. I think everything comes down to be kind, and just take that step back and realise that actually, even though we're not dealing with an inbox full of paperwork, we've got live patients that we deal with. We just need to be smarter with our processes to allow us to be in our best condition to then facilitate the best care for our patients and our clients.
This new manual on practical veterinary welfare will be available early 2022. For more information and to register your interest, please visit our website at www.bsava.com.